Many of us think that when we have pain in our knee, it's our knee's fault. But the truth is, the knee is a simple joint that just flexes and extends, and it's meant to provide stability. You may be surprised to know that the pain is usually the result of another weak muscle or a tight structure that's not even in your knee. In this episode, we're going to talk about one of the top causes of knee pain and the top 5 exercises you can do to decrease the knee pain. Welcome to Better Mobility, Better Life, where you can learn how to break mental and physical barriers to become a better athlete, a more functional human, and how to age with grace using physical therapy techniques. If you're new to the channel and you want to learn more about increasing your mobility, regaining functionality, living pain-free, and overall a better life, hit the subscribe button and ring the bell so you know when a new video comes out. Of course, it's rational to think, I have pain in my knee, it has to be something in my knee causing it. But it's most likely not the knee's fault. No, the poor knee just takes the brunt of what is going on above and below the joint at the hip and the ankles. The knee is a stability joint, and both the hip and the ankle are mobility joints. This means that in order for the knee to work in its optimal manner, it needs the help of its neighboring joints to be in a position where it won't be stressed out or decrease the pull on the knee. I see this a lot with patients that come in and have a diagnosis from an MRI or an X-ray of osteoarthritis, meniscal tears, patellar tendonitis, and chondromalacia. But before you go off and start thinking surgery, let me tell you where I tend to go first. It's all in the hips, specifically hip abductor weakness, which are the muscles that help you move your leg out to the side and also stabilize that pelvis and the hips when you're standing on one foot. You do this every time that you're walking, and weakness in those hip abductors can affect how you're walking or your gait cycle. As far as the anatomy goes, the gluteus medius is one of the main hip abductors, but the gluteus minimus and the tensor fasciae latae also assist in that hip abduction. As for most people, the glutes have become lazy. So what does this mean? Weakness in the abductors typically leads to an internal rotation and adduction at the hip. And this puts us in what we call a valgus position or a knock-kneed position. It throws off the alignment of the kneecap and redistributes forces in the knee, typically putting more pressure on those areas than others. So how can I tell that my hip abductors are weak? There are 2 simple tests that you can perform to see if you are guilty of hip weakness. The Trendelenberg is the first test, and that you're going to stand on one leg. You should be able to maintain a neutral pelvis or an even pelvis, but if your hips are weak, you'll notice that you'll lean to one side. The second test is the squat test, and for this test, you're going to stand with your feet a little bit wider than your shoulders, and you're gonna go down into a squat, and what you wanna see is that your knees stay in good alignment with those ankles. If the knees tend to cave in or you get a little knock-kneed, that means that those hip abductors need a little strengthening. So how do I fix this? The first exercise you're gonna do to strengthen those hips, you're gonna be laying on your side. So you're gonna find a mat or your bed, turn onto your side, and you're going to extend that top leg out. Make sure that it's nice and even with the rest of your body and your hips are pointed upwards towards the ceiling. You're going to strengthen the quad, you're going to contract that quad, keep your toes pointed to your nose, and you're gonna lift up in the air and come back down. You only have to hold it for 1 to 2 seconds up in the air, and you should start to feel the side of your hip burning. So for this exercise, I typically want about 2 to 3 sets of 10, and you may fatigue early initially. So if you just work yourself up to that 3 sets of 10 daily, that should help with the hip strength for those hip abductors. All right, so the next exercise that we're going to do is hip abduction with the resistance band. So this is usually used after you can do 3 sets of 10 fairly easily with the last exercise I showed you. So you're going to put the band around your knees, you're going to straighten that top leg again, and you're going to lift it up in the air, and that band should add extra resistance. So you should do this exercise once you are able to complete 3 sets of 10 in a row without the TheraBand. A good progression for this is then going into a side plank with hip abduction. So you're going to lift up into a plank position, get your hips up nice and high, and if this gets easy, then you can start moving that top leg up. So I would shoot for about 30 seconds at a time and then come down and take a break, and I would do this 3 times on each side. The last exercise that you can do is in the standing position, and this is called a lateral band walk. What you're going to do is you're going to again put the band around so that it sits right above the knee joint, and you're going to get into a squat position, and then you're going to move in one direction with your right leg coming out and then legs back together, and then with your left leg coming out and legs back together. It's best if you do about 8 to 10 side steps on one side and then switch to the other side. Again, you should feel a nice burn in the sides of your hips, and take rest breaks with this one as it will be pretty fatiguing for you. All of those exercises work the hip abductor muscles, but often the hip external rotators are weak as well. So these next exercises are good to work the hip external rotators. Again, if you have a mat, what you can do is you can lay on the mat and you're going to go into a hip extension. If you have a bad back, this is probably not the best position, but if you're fine here, I want you to just squeeze that glute and lift your leg up in the air. Keep that leg as straight as you can and really try to hold it for about 2 to 3 seconds. And again, if you can do 3 sets of 10, that will really help with the gluteus medius muscle. If you do have a bad back, you can switch this or modify this into a quadruped position, or getting on all fours. For this, I want you to keep your back nice and flat, keep your abs engaged, and what you're going to do is you're going to kick up in the air, squeezing that glute muscle as you do this. So again, if you can try for 3 sets of 10 on each side, you should feel a really good burn in that glute. And then if this is too painful for you to get on your knees, you can also work it in the standing position where you just keep those abs nice and tight and you kick back, but I want you to really squeeze that glute as you kick back. Keep that knee nice and straight, and again, we're gonna go for 3 sets of 10 on each side. In order to get your hip external rotators, get in that quadruped position again, or on all fours. That back stays nice and straight, and again, this is a high level activity and you need to have really good mobility in your hips. I'm gonna have you lift your hip up to the side and come back down. So just hold for 1 or 2 seconds, come back down. Again, you're striving for 3 sets of 10 and you'll start to feel a really good burn in the side of that hip muscle. If you've enjoyed this episode or you want to learn more about the types of knee pain and approaches to relieve the pain, make sure to subscribe to the channel and click the link. Until next time.